What I have up, I saved all the pictures I pulled yesterday, I saved their URLs and pre-opened them. Make this fast. Now, the last week, the last thing we did was latissimus dorsi, all right? And you probably guess it's on the dorsal side of the body, fibers run to the lateral. The name tells you that, shouldn't be scary. It's this one, remember? Yep,
Most of the back.
Yep, main part of the back. So when we look at it, the insertion I want you to see is on the front of the humerus, on the anterior side. See that? It wraps around the muscle. So, go ahead. So when we look at it, right here, lat dorsi, arm extension, adduction, and medial rotation. The medial rotation and the adduction are because we're attached here. Obviously, if you have your hand up here and you pull this muscle that contracts and goes to the back like there, as it pulls, it's going to pull the arm. That's the adduction. Because it's pulling here, that's the medial rotation. Does that make sense? Everybody good?
Okay.
All right. So the last thing on the torso was the erector spinae. Now this is a really good one because the name tells you what it does. You don't need to know the origin. You don't need to know the insertion for this class. And you do need to know what it does. But you probably guessed it helps you keep your spine erect. I'll show it to you real quick. And then we'll move on. Right here, you see it? Now, we're talking muscles that go from the os coccyx, from the ilium that sticks up on the os coccyx, all the way up. We're attached, some of it's attached to the spinous processes on vertebrae. Some of them are attached to the ribs. You have some that go all the way up to cervical ribs. Look, you even have two small pieces that go all the way up to the mastoid process. What does that mean? It does exactly what the name says, erector spinae. Imagine you're all slumped over like this. That muscle, as it contracts, all the way up. Good? Good? Even to the spine, to the cranium, because the mastoid, it can help raise the neck. So, erector spinae, easy to tell what it does, but just like our sternocleidomastoid, you can do the left side muscles or the right side separately. Does that make sense? That's, or I should have said like the splinus capitis. That's why it says bend the column laterally. When you do this, and you do this, part of that is using one of the erector spinae sides, not both. Good? Contract the right, you'll bring it to the right. Contract the left, you'll bring it to the left. Are we good? There? All right, so you've got that. We are now done.
Is that deep or superficial to the latissimus dorsi?
Excellent question. I do not know the answer. I've got a lovely full dissection of the human body illustrated that I will look up after class if you remind me. The reason I don't know, there is a deficiency in what we have to work with in the classroom. You might have or I should say in the lab room. You might have noticed that most of our models have all of that cut away to show the spine. Does that make sense?
Yeah.
So, yeah, I would say that since we know, it's hard with isolated muscles, but I would guess that this is just a guess, going to be deep to both the lat and the trapezoid, the lat dorsi and the trapezoid. Because part of what it's bound to is the spinous processes of the vertebrae.
So that's the undercoating.
I believe so, yes. All right, so let's move on. We're now going to look at muscles in the arm, and we'll start with easy, well-known. We've done this before. Here we have, what was the triangular muscle in the shoulder? Upside down triangle?
Trapezius.
No,
that's
this
the deltoid.
Is a deltoid. Deltoid
Sorry, in
tuberosity.
the shoulder, not the other one.
In the shoulder. Okay, here, I can pull it up. You can pull it up. We'll come back to that. We'll do our deltoid right now. It's probably not there, so we'll do it here.
You said the shoulder, and that threw me.
Yeah, I did say in the shoulder, but let's pull it up so everybody can see it.
They have painted nails.
This is your deltoid. Notice, origin insertion, we talked about that. Which one moves more?
Oh, the arm. The insertion.
No, I appreciate that you tried. I'd rather have that than people who aren't willing to say anything. Okay, so the insertion is the end that moves more, the origin moves less. In the shoulder, if you're attached to the scapula and the clavicle, you can move your shoulders, you can move them, but that's a lot less often than moving the arm around to do things. Do we agree? Picking up food, picking up pistol. So, the insertion is the end on the humerus. Now, you know that in this class, we are, when we say learn the origin and the insertion, we're making it easier. We're giving you name of the entire bone. Okay? So this shouldn't be hard at all. Clavicle, scapula, and humera. But you see it does abduction of the humerus. What does abduction mean?
Away.
So how do you do this? It's attached there, so when you contract, it pulls away. Does that make sense? Everybody good? Okay. So that's straightforward. Now the trapezius, we did this before. This model, you can barely see a piece of it, but you have trouble with the trapezius. If you don't, this annoys me. I shouldn't have opened all the tabs. That was a bad thing because I'm going to open them all again. So your trapezius is trapezoid shaped, diamond shaped, kite shaped, whatever you want to call it, on the back. And it is, this one looks a little better. No, this one does because it shows that it goes all the way up to the head. It's attached to the occipital bone there. It goes over the cervical vertebrae, but it goes all the way down thoracic vertebrae. It goes over to the scapula. It covers the suprascapularis. Sorry, you guys with me? Make sense? Yeah? Okay, this is our trapezius. Would you agree if you contract these muscles, one thing you could do is raise the head, you could extend the neck. Another one, you could raise the shoulders. Say you used your sternocleidomastoid wanting to pull you this way to stop the head from being extended backwards. Oh, what would we call that? We use a muscle to stop another one from doing something. I'm looking for an F word.
Fixator.
A fixator, very good. So the sterno is being a fixator to stop us from letting the trapezius pull like that. What would happen? Shoulders would rise. Does that make sense? Okay. So let's look at our make sure we're not leaving anything out here. Trapezius, we have, I don't know why they didn't highlight it, but you do have an origin, you do have an insertion, and it either extends the head, that means bringing it back, or shrugs the shoulders. So we've got that. But the occipital bone and the cervical and thoracic vertebrae, that is the origin. The insertion would be the scapula and the clavicle at the shoulder. Everyone good? All right. Now I'm going to show you 4 muscles, and I want you to, first we'll talk about what's similar, then we'll talk about what's different. If you look at the supraspinatus, infraspinatus, subscapularis, teres minor, we're listing the origin insertions as exactly the same on all 4. But look at the actions here. They are not all the same actions. How is that possible? It's possible because you can attach at different places on a bone and get different actions. So the supraspinatus, let's go to the scapula attachments because these are all named, no, not the teres, but these are named for their attachments. You might remember I talked about this skeletal model as being a really good one because it has all the origins in red and all the insertions in blue, yes? Okay. Well, here we have a scapula, everybody's down with that. Here we have, what's the name of the feature?
The spine.
Spine, very good, spine of the scapula. So this is our supraspinatus, this would be our
Infraspinatus.
Yeah, thank you, infraspinatus. What I was fumbling on was this, the subscapularis, okay? The subscapularis is between the ribs and the spine, the ribs and the scapula, you can see it right there. Infra is below, so infraspinatus is right there. and supraspinatus is here. Does that make sense? Everybody good? Now look at the actions, and we can pull all of these up. Okay. So supraspinatus, abduction of the arm. Abduction means it's taking away, yes? So muscle located right here. I should turn it. Muscle located right here. It's going to attach to one of these three. I think to the middle one. And when it contracts, that's going to pull like that. That's your abduction. Everyone good with that? Yeah. Okay. Infra, which is here, it says it's going to rotate the arm laterally. That makes sense. You wrap around and attach there. When you contract, it's going to pull the arm like that. Pull the arm like that. Does that make sense? Everybody good? All right. Rotates the arm medially, the subscapularis. It's still attached to the scapula and the humerus, but it's the exact opposite. How? Well, remember, it's this one that's between the scapula and the rib cage, yes? Those fibers run along between the scapula and the rib cage, and they attach like that. So when they contract, they're going to pull like that. Does that make sense? They're going to pull like that. That's how you get your medial rotation. So if you're first looking at this stuff, you might be like, how can they have the same attachment point and they have opposite functions? They don't have exactly the same attachment point. We're only making you learn the names of the bones they're attached to. But infra goes up here, and when it contracts, it's pulling like that. So you get the rotation medially. And sorry, I said infra. Sub does this, and when it contracts, it pulls like that. Infra goes like that, and when it contracts, it pulls that way. That's how you get opposite functions. Are you with me? Okay, so that's good. Pick that up. All right. Teres minor, also scapula to humerus, rotates laterally. Let's pull it up. I shouldn't have opened all these tabs. I've said that before. All right. I'm doing this so I don't sort through all the tabs. All right, so here you can see we are attached to the scapula. We are attached to one of the things you didn't have to learn the names of. This will probably be called the lateral margin, and this will probably be called an inferior angle. We're attached right here going over there. So the function that they had was that it would, I believe, I'm going to look at our function, was that it said that it would rotate laterally. Yep, see, rotate laterally. How do you pull that off? Pretty simple. If you go from here to there and you contract, it's going to pull the muscle like that. Good? Good? All right, so that's your teres minor. And remind me to tell you a horrible story later about rotator cuff injuries. Anyway, okay, so let's move on. We are back here. We have taken care of those shoulder muscles. We're now in the arm. Everybody should, as we're talking about these muscles, you should find them on your model. I'll tell you right now, the instructions for the study guide say you should be able to find them on illustrations or on models. And I'm going to use both. Obviously, something like the trapezoid, where all of our models are missing most of the back, is more likely to be on an illustration. Does that make sense? Okay. Coracobrachialis. What are we doing here? It's named for where it's located. So the origin has to be on the coracoid process of the scapula. Good. The insertion in the brachial area. All right. So inserted on the scapula, originating on the scapula. Oh, I'm on the wrong line, no wonder. Origin on the scapula, inserted on the humerus, flex and adduct the humerus. So the coracobrachialis, we are going to have, I'm just going to do this very quickly and use these. Those are all the ones that we're going to be reopening. Go there, so excellent. All right, I'll open that again, but coracobrachialis. And the coracoid process is the bird head looking thing on the scapula. You guys remember that, yes? All right. So, I don't like that picture. Here we go. Ken Hub, I trust more. There we are. These are pretty pictures. There's the beak of the bird. Here's the head. So right at the end, this is our acromion at the end of our spine. You see that? Here, let me open it up bigger. Open image in new tab. There we go. And let's blow it up a bit. Okay, clavicle. We're looking kind of diagonal, but this is the anterior surface. Obviously, the spine is on the posterior surface. This is the end of the spine, the lateral end of it, called the acromion. It articulates with the clavicle. Everybody's good with that, yes?
Yes.
All right. Coming from that to partway down the humerus, and where is it attached on the humerus? I would say
The brachial region.
medial and a little posterior, probably. Let's pull it up from another angle. All right. So, coracobrachialis, let's go for another picture. Okay, yeah, this one works, Definitely, okay, so same source, skin hub, just a different angle. This one definitely is attached to the coracoid process and to the medial surface about halfway down the diaphysis. You agree? So, if we look at our functions, coracobrachialis flexes and adducts the humerus. The adduction is when you contract, it's going to pull the arm back to the midline, yes? The flexion is, remember when we talked before about, and I will pull this up in a second, when we did articulations on page 171, you don't have to flip if you don't want to, I'm going to pull it up. But this is something that you pointed out, Alex. I was like, what the heck are they talking about? You said head and neck, and you were 100% right. It's the angle is with the head and neck. So I'm going to move this down enough that I can draw on the board. Come on. It's not complicated. There we go. You remember this picture? In the lecture, it had a black and white background. That's the only difference, of white arrows. But we said that flexion is doing that, extension is going like that. And you're like, huh? How can raising the arm be flexion? It was this angle. If we are going upward, we are reducing the angle. You agree? So that's flexion. So when we look here at our coracobrachialis, flexes and adducts the humerus. What you're doing, the adduct is easy, you pull in, but because it's attached a little bit to the front, it's medial and anterior, when you pull it also will do this, so you rotate like that. Does that make sense? Okay, that is the flexion part. They're just saying that the arm elevates a little bit. Good? Good? All right. Now, we're into familiar stuff. We've talked about the biceps brachii many, many times. You know that it's attached to the scapula and to the radius. That means it crosses two joints, yes? When it contracts, we have prime mover for elbow flexion, but it also would want to raise the arm because when you contract, it's pulling like that, pulling on both joints. If we use a fixator, we could fix the shoulder and all of its effort goes into the elbow. Or we could fix the elbow and all of its effort goes into extending the shoulder. Are we good? Or flexing the shoulder, I guess is what they're calling it. All right, yes. Okay. So flexes the elbow joint. Antagonist of extension. The extender would be the triceps brachii. Do you agree? Okay. And if it were to contract, it would oppose. It would be an antagonist to the triceps. Everybody good with that? Yep. All right. So I want you to know it crosses two joints. I want you to go from the scapula to the radius. Everybody good? Oh, what's another easy question we could do about it? Well, give me a way that people name muscles. We know region from brachii. What's another way we might name muscles?
Size.
right? And that's not what
Shape.
we're doing here. We're going for how many parts. It's a biceps because it has 2 heads. Does that make sense? Triceps would have 3 heads. I saw an eye roll, I'm sorry, but it is something that I'm supposed to have you remember. Ways of naming muscles, this would be an easy one, it wouldn't be complicated. I like easy, not complicated. I think you do too.
Okay.
All right.
Is it always named after the number of insertions, or can it also be the number of origins?
Excellent question. When I described it just a moment ago, I punted and said the number of parts, or I said the number of bodies, remember? That would be true for either one. I think the biceps is named because it has different spots of attachment on the scapula. So multiple. Let's pull it up to make sure and see, but the here we go, origin insertion. You should have multiple origins.
If you're showing us, we can't see it.
Oh, okay, well, I will pull it up. Thank you. All right, and we'll go for this one again for Ken Hub. They didn't have pretty pictures. Do you see that it's attached to 2 different places on the scapula? Yes?
Yes.
So in this case, it's 2 different places on the scapula. Right here, on the insertion, we got 2 different places. So I think it could be either one. 2 heads is how I would define it. Good? Yep. All right, moving on. That was a good question, Alex. Now, the prime mover for elbow flexion is your biceps brachii. Oh, by the way, why do you want to put biceps brachii on the test and not just biceps?
Biceps femoris.
Be right, because you have on the posterior side of the leg, you have the biceps femoris. You have to put it down so I know which one you're talking about. Good? Clear? All right. Now, here we have another elbow flexor, the brachialis. You're going to see here we have another one, the brachioradialis, another elbow flexor. These are examples, I'm about to pull them up, but these are examples of what? Not a prime mover, not an antagonist,
Synergist.
not a fixator. Yeah, use the S word loud.
Synergist.
A synergist. You're going to have to know those words on the test. Yes, people? Okay, these will be examples of synergists to the biceps brachii. All right, let's pull them up. So our brachialis is right here, and it crosses the elbow joint, but unlike the biceps, it doesn't go all the way up to attach to the scapula. So it's lower humerus across the joint. This is your brachialis muscle. It's a helper, it's a synergist. Everybody good with that? Yes?
Where would it be on this?
Let's take a look at that model and see. All right. Could use the quick sheet, number 14, but let's actually work it out and pull it out so we can see. That would also be useful if I could see with my glasses. All right, so on the key number 14, this right here, right? See the end of the deltoid? Look just below that. The loop in this model is on number 14, the brachialis. Everybody good?
So
Yes.
the one directly under the biceps.
Yep. Well,
If you take off the
I'd say just lateral to.
if you take off the
11's
biceps, it's like the whole thing.
Okay, yeah, I can accept that. But 11 should be your biceps is right here, and your brachialis is next to it a little towards the thumb side. You see it? So I'll go ahead and take the deltoid off so we can look. That's a pain in the butt. Okay, and then we'll take our biceps off. Yes, you're right that the brachialis is below, but you can clearly see it even when the biceps is in place because there's one side of it that peeks out. Are we good? Make sense? All right. Now, the next thing on our list was the brachoradialis. Let's go ahead and do it. All right. Brachio, I should have said brachio, I left out some of the. Here's the brachoradialis. That was a scary sound, folks. We're okay, we'll live. Just don't break anything, it would make me sad. Here, brachoradialis, I want you to notice, in a little bit, we're going to talk about a leg muscle called the sartorius that I described the movement on as being S-like in shape, the shape of it being S-like because it wraps one direction and then back the other way. That's what you're seeing here in the arm. Look at how we are attached. We're going right here. This is the posterior side of the humerus, and we're coming from the interior around. We're standing anatomical, so we're going around the lateral. But when we get to the back here, we don't just come down and attach to the carpus. We then later are going to wrap back around to the interior and attach to the front of the radius. You see it? Okay? So what you have going on here, it goes from interior to posterior, and then posterior back around the next bone to the interior. That's going to be the same kind of movement we'll see in the sartorius. I know that's weird, that's weird. Let's pull up some other pictures. So, would you agree right now we have a piece of the capitulum peeking out? We have the trochlea here. Yeah?
Yes.
Okay. So this is the anterior surface of the elbow, yes?
Yes.
Look here, running laterally down the side and attaching here, okay, to the radius. This is the brachoradialis. So, we got that. Let's go for one more. That was not as useful as I thought it would be. Okay, and here we go. Brachoradialis. The head is up high, and it is on the, okay, these are flexors, flexors, flexors. Okay, so the body of the muscle is going to be on this side, okay? That's the palm of your hand. The body of the muscle is going to be here, where we have lateral but anterior when we're standing in anatomical position. Yes? Okay. That's our brachoradialis. All right, let's move on. Triceps brachii. We know this one. We love this one. Surprisingly, they're not giving us origin insertions. Should be really easy. It extends the elbow. Yes? It is the antagonist to the biceps brachii. Everyone good?
Good.
All right.
It's the entire underside of the arm.
Pretty much, yes. All right. Supinator and pronator teres are named for the motion. I want you to remember, if you take your thumbs and rotate your arms so the thumbs go laterally, thumbs move laterally, it's now really easy to hold a bowl of soup. You would agree? That motion is supination, and the muscle that causes it is the supinator. The reason you're capable of having supination and pronation is that these muscles wrap around the arm. Good? So let's look at pictures and you'll see they wrap around.
Oh, they crisscross.
Yep.
Ooh.
Okay, would you agree we're wrapping around the radius here and attaching on the other side? We're actually here and a complete loop around. When that contracts, it gets shorter, it's going to cause you to rotate your radius inside the, of course this one won't do it. Your radius inside the radial notch of the ulna. Does that make sense? Yeah? Okay. So when you have one of those two muscles doing it, the supinator is going to cause supination. It's going, when it wraps around and gets shorter, it pulls the arm to a supine position. Good? Good. All right. The pronator is going to be a little longer, but you're going to have the same thing happening. Let's do it. So here is our pronator teres. It looks it's a little more obvious because you don't have that quick wraparound thing. This is wrapping around the arm, not like that one bone, which is what we had before. But this is your pronator. Okay. Your pronator is going from, hey, is this the look at the elbow? Or we look at the proximal or the distal side? I shouldn't say, that's horrible. The anterior or the posterior side. You should be saying we're looking at the anterior. Why? Because we don't have the big hole for the olecranon to go into. Does that make sense? And you can see the capitulum here and a piece of the trochlea. Well, if we're doing that, this is the anterior side, the radius is here, we're looking on the right side, we're going from the medial around to the lateral. When that gets shorter, it's going to pull like that. Does that make sense? It will cause pronation because it pulls like that. Everybody with me? So the pronation means the movement like you were going to lay prone on the bed. Good? Good? All right. So we've got that. Extensor digitorum, flexor carpi radialis. These are not bad. Extensor digitorum tells you that it extends the digits, extends the fingers. You with me? So say we put your arm out in a fist. Now imagine a bunch of tendons going to the digits, pulling like that. Okay? So we're going to have tendons crossing the joints. Why do we not put the muscles down here? Because we've got no room. It has to be really thin. So we put the muscles up here and we run tendons down to do that. Does that make sense? Okay. So let's pull up the extensor digitorum. Oh, right here it says in the book, figure 13.3 and 14D. What, I don't know why I'm doing this. It probably is faster to do it the other way. 13D, give me that back. Okay. Is that 12? Yeah.
213.
13. D like delta. Okay, fast. 13.3, I'm looking now at 13.15, I'm way too far, okay. So 13.2, there we go. And extends.
We're not seeing it.
Well, that's a hideous picture.
We're not seeing it.
Yeah, I haven't pulled it up yet. I know that's what they're tittering about. But I'm like, we're not seeing the tendons at all. I'll show you. But we'll probably come right back because that'd be easier. It is a hideous picture. All right. So flexor carpi radialis, that's clear. But our extensor, not so much. All right. The other picture that it said to look at was 1312D. We'll go back to 1312D and try
It's on
that.
page 213.
Thank you. That's very kind of you. As opposed to tittering at me, it's making me ultra paranoid. You said 213?
Yeah.
All right. And this is 19, so we skip back. Here we go. All right. Looking at 213. Here, the extensors are going to be on the front of the arm because they're pulling like that, just like we were talking about before. All right. So we were looking for extensor digitorum, and we have extensor digitorum right here. It's on the thumb side of the forearm, and it is long, and it divides into separate tendons long before you even get to the carpus. It has a tendon going to I was gonna say all the digits, but that's not true. It doesn't have one for the extensor pollicis longus. It doesn't have a tendon going over the thumb, but you knew that because you can do this, yes? Without moving the thumb. So all of these tendons, they start about here, proximal to the carpus. And the muscle doing it, the extensor digitorum, is going to be on the thumb side of the forearm. Are we good? Yes? Okay. All right, so we've got that. And then flexor carpi radialis. The flexor, oh, of course. We're still looking at the interior side. I assume that means the posterior. Yep, right here. So flexor carpi radialis. It's going to be in a little bit in the middle, but closer to the thumb side. It's going to come down. Right here, this is something we haven't talked about. You're not required to know, but it's really, really important. This band of connective tissue has a special name. That's your retinaculum. Would you agree, just think about a muscle right here. If it was to contract and cause flexion, if it had nothing to keep it in place, it would rise up as it pulled the hand and fingers. Do you agree? It would rise away from the bone. So to avoid that, you got some bands of connective tissue that hold it down in place. No, same idea. You get the idea? When it's causing flexion, it doesn't rise up. Like the fingers are up, so the tendon goes up. It's held in place by a retinaculum.
So our muscles are duct taped down.
They are held in place by connective tissue. Hopefully that's not as tacky and dreadful as duct tape, but you get the right idea. You have a thing that they can slide underneath of. Good?
Duct tape.
And that's a retinaculum. Okay, so we've done flexor carpi radialis. You guys feel comfortable with that?
Yes.
All right. Oh my God, we have done arms. Let's move to the thigh. Muscles of the anterior thigh, the front of the thigh. So, your sartorius, I want you to think of the word slender. I want you to think of an S shape, okay? In specific, double checking on the key, but what I believe the sartorius should be is this one here. Of course, I can't see the number.
Yep, down. 24.
All right. This one right here, look at how it comes down, wrapping around to the medial, but then as it crosses the knee, it goes back the other way. Do you see it? So we're coming from the iliac crest, actually the spine of the ilium, coming like that to the medial, and then we pass the knee wrapping back to the lateral. You guys see it? Okay, you found it on yours too? Okay. So I've used this one before on tests, and the thing I always tell people, I should have pulled that in first. It is long, it is slender, it is kind of, if you use your imagination, S-shaped. Because it goes from, here, I'll do it again. You're not, I said that before. I'll say it a bunch of times if you get it, until you get it, it's back in place. So right here, would you agree this is the iliac crest, yes?
Yes.
Would you agree that it is off to the side, it's not in the midline, not in the medial, okay?
Yes.
Now it is the medial surface of the ilium, but follow as it goes. When we go from here to there, we're coming down to the medial, yes? Now watch it go back the other way. You see it? Okay, so think of it. Now you really, I admit what I'm saying, you have to use your imagination, but watch. Let's see, how can I make that stop? I can make that stop. I have white space to write on now. You ready? I probably should pull up the leg and dip, I'll just do it. If we have the ilium here, the iliac spine like that, we have that muscle coming
Bless you.
down and across the thigh, down, 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 towards the knee, and then coming back like that, and straightening a little. Do you agree?
It's a
All
weird
right.
S, but it's an S.
So, use your imagination a lot, but S-shaped. You with me? It also helps you remember the S in the name. Good?
Sartorius.
It's the sartorius. It's long, it's slender, and its path is similar to an S. Are we good? All right, let's talk about what it does. The sartorius flex the thigh, abduct the leg, bring it back in, laterally rotate the thigh. What are we doing? That's kneeling, sitting with your legs crossed. Good? Yeah? I shouldn't say kneeling, I mean getting on the ground. Everybody good with that? All right, now the next four on this list of muscles for the thigh are the quadriceps. All right? The first one is the rectus femoris. We're coming back to that later. That one's special. The other three are attached to the femur for the origin and the patella and tibia for the insertion. That's true of all of them, yes? All three of them have the same function. They extend the knee. See how my knee is down? You take the quadriceps and contract it. You raise the knee. You extend the knee. Good? Now, the one here on the medial side of the leg, it's a big muscle on the medial side, so it is vastus medialis. Good? It's in the name. Now the one on the lateral side, it's a big muscle on the lateral side. It's the vastus lateralis. The third one is in between the two, in the middle. It's the vastus intermedius. Great names. Over top of those, you have the rectus femoris. We've talked before about how that goes straight down the leg over the femur, yes? Why did I say we do the rectus later? It's special. It's different from the others. And they tried to make this really easy for you. You need to know the origin and insertion for all three vastus. They didn't ask you to know it for the rectus. But I do want you to have one additional detail. If you're attached to the femur proximally, origin, and you go down distally to tibia, the fibula, you cross one joint. All three vastus have the same bones for origin and insertion and cross the same joint. The rectus, the one that's different, the one that's special, the one I said we'd come back to, crosses two joints. You don't need to know the origin and insertion, but I want you to know the rectus is attached up here in the oxycoccus, the pubis. Okay, I shouldn't say the pubis. In the hip bone.
Girdle.
There we go. In the hip bone, and it crosses the hip joint and goes down the femur and then crosses the knee. All four of those muscles, vastus medialis, vastus lateralis, vastus intermedius, rectus femoris, they have a shared common tendon that embeds on the patella. That's the tendon of the quadriceps. Everybody good with that? Yes? No?
Yes.
All right, moving on. Thank you, by the
So
way.
you got 4 muscles for the knee and
Yep.
1 for the hip.
Yeah, exactly. Well, there are other things for the hip, but yes, of the quadriceps,
The main ones.
one for the hip. Yeah. Now, we have another one here, adductus longus. You know it's going to bring the leg towards the midline. It's in the name. It says long muscle that draws the leg to the middle, right? That's what the adductor is. All right. You don't need to know the origin of insertion, but you need to know that it adducts. I hope you get that from the name. You need to also know that it medially rotates the thigh.
You're still on the
flexes.
projector.
Okay. What?
You're still on the projector.
Oh, okay, sorry. So, let's go ahead and pull it up. Our adductor longus is because it does that rotation, you know, it wraps around the bone a little bit from one side to the other, so it
The
can...
long puller.
What?
The long puller.
Yeah, exactly. Well, let's pull up both. The magnus would be the bigger one, but adductor longus. Here we go. Oh, come on. There we are. So our adductor longus, it's a long muscle. It's attached to the pubis. It crosses the hip, and it comes down to about halfway down the diaphysis of the femur. Good?
Yes.
Yeah, all right. So we've got that. That's pretty straightforward. And we'll look at the functions again. It does adduct. So obviously that diagonal pull is going to bring the foot towards the midline. Medially rotate, it's going to take that acetabulum, it's going to pull like this. What that means is that the attachment point, not that you need to know it, but the attachment point on the diaphysis of the femur, it's not going to be back here, it's going to be somewhere a little bit forward, a little bit more interior, so when it pulls it'll cause that as it brings the foot in. Does that make sense? Everybody good? Okay. So you've got that. Helps you sit cross, so it helps you flex the thigh. And that makes sense because it crosses the thigh. The only joint it crosses is the thigh. So when it contracts, it's going to make the thigh move. All right, we are done with the ones on the interior. We're going to do the lateral and the posterior. Now the tensor fasciae latae, fascia is a thin sheet of connective tissue. So I want you to think of a very thin muscle, okay? Look on the lateral side and very, very thin. And it will travel down past the knee. So,
Is that the white band?
did I...
No, okay.
The one on top of the white band?
All right, right here. This is the picture that I used
Either
before
18 or 19.
that I thought looked good. Oh wow, a full human dissection. Okay, I don't know if that's, I don't know why I chose that one because that's not especially good. It's too zoomed in to be useful. Let's just do this. Oh, but it's in Wiki, so we can go back to the article. There we go. So our tensor fasciae latae, it's on the lateral side. That's why latte. And remember, I said it'll be really, really, really thin. Let's go down the outside. The muscle is up here, and then we're going to have this band, the iliotibial tract, the IT, is all this connective tissue. The muscle ends way up there with its fibers embedding into that tract. Everyone good?
Yes.
Yep, okay, lateral side. So you can guess the tensor fasciae latae will flex, it's crossing the thigh, sorry, it's crossing the hip. It will abduct, it's on the lateral side, and if we contract that muscle, it will pull away from the midline. Good, good. So that's the abduction. And it says medially rotate. How do you get that? Well, the way you get that is that it doesn't just stay there. It goes around and wraps a little. Good?
Yes.
All right. All right. Gluteus maximus, right here. We actually have 3 glute muscles and 2 of them are on the list. We have the maximus, we have the minimus, and in between we have the medius in the middle. Good? But this is our gluteus maximus, and the action they give you on your list is if you are climbing stairs, stepping up on something, the movement that's about to start, that movement is gluteus maximus contracting. It's pulling the leg this way. It is extending the hip and helping me go upward. Does that make sense? Everybody good with that? Yep. So, gluteus maximus, you don't need no origin insertion, but but extends the thigh like climbing stairs. Now the medius, which is smaller and in the middle, I already told you, we have a minimus that's deeper and smaller than the medius,
I
but
think it shows it on that. Does it not?
yeah. Okay, so here the maximus is cut away, and here we have a medius. Good?
Hold on.
Yeah, that's fine. That's fine.
That one.
Good.
Right
Yep.
there.
All right, so let's pull it up on this picture too. All right, so our gluteus medius, this is a lot, not all, but a lot of what is happening. I don't like the green backgrounds, everyone had that. But a lot of what is happening when we go from the lateral side, lateral to posterior of the ilium, down to attach to the femur, very proximal end of the femur. That's going to be moving when we contract. It's right there. When we contract, it's going to pull like that. Does this make sense to everybody?
Yes.
Yep. Okay. So that's our medius. You don't need to know the minimus for this class. You will eventually, I'm sure, but you don't need to know it right now. Let's pull it up right here. So this is our maximus. Deep to it, but sticking up above it, right up by the crest of the ilium. This is going to be our medius. Good? Oh, no, I take that back. This is our medius. C is our medius right there. Not all the way to the crest. All right, so we've got our gluteus. We're now to the posterior. We did the lateral. We're now on posterior thigh. The biceps femoris has something very similar to the biceps brachii. Not just two parts, two joints. See how this extends the thigh and flexes the knee? That means it has to cross the knee and, let's see, extend thigh. Oh, I shouldn't have said that. I thought it crossed, but no, it flexes knee. Okay. So inserts, yeah, it does. Okay, tibia and fibula, femur and ischium. So it does. Part of it crosses two joints, which is what I was about to say. So part of it is femur and then cross the knee. Part of it is ischium, probably ischial tuberosity. That's where we do most of our attachments. Ischial tuberosity crossing the hip. So let's pull it up. And brain. So we're on the posterior side. And I'd rather have a Ken hub. Here we go. All right. Yeah, I don't actually like that drawing. Let's do this. All right, so why is it a biceps? Because it's got two heads. Good. Let's now see if we can find a better picture. This will do. All right, two heads, but it crosses, part of it crosses the hip joint on the back and crosses the knee joint. So that's where we get the ability to extend the thigh and flex the knee. Everyone good with this? Okay. Now, semitendinosus, semimembranosus. Semitendinosus has a lot. It's going to do the same thing. It's going to cross two joints. You don't need to know origin insertion, but we're going to pull it up. So
29. 29. It's at the top of 30, right there. Right there.
okay, here we go.
It's that one there. On the underside of it.
Here we have the biceps, which is, oh, we're looking at this. You should know already from looking, but I'm gonna pull it up to make it easier. Looking at this, look at the tibia, look at the fibula. We know the fibulas are lateral, and that's obvious because here we have the middle of the pelvis. But notice we don't see a pubic symphysis, we see a coccyx. Well, we're looking at the posterior surface of the thigh. Good, posterior thigh muscles. Notice the biceps is the most lateral. The semitendinosus is the one that is in the middle, and the membranosus is the most medial. The M should remind you the membranosus is the most medial of the three. Does that make sense? Everybody good with that? Okay, so you have that. And notice the biceps attachment point, we're talking fibula. Okay? The tendinosus, the membranosus, we are attaching posterior side of the tibia, posterior and medial. Good? All right, so let's look at what it says it does. The tendinosus says extends thigh, flexes knee. That makes sense. It's crossing, it's going to pull that way. When it does, it's going to cause you to bend the knee. Good? Yep. So it's attached on the medial side of the back, and when it contracts, it pulls like that. Okay. Now the membranosus, same function, just a little more medial for the path. Good? Oh, here, you said what? Let me show you. Right here, we had the most lateral is the biceps femoris. Middle is the semitendinosus. The membranosus with the M is the most medial of these three. It's attached in a very similar spot. We can look on this side. Comes down. It is a little more proximal and a little more medial than the tendinosus. You see the attachment point? Yes?
Yes.
Okay. Feel better?
Yes, I was just confused because of the numbers.
Okay, that's cool. That's cool. All right, so we should be good with this. Now, muscles of the lower leg. We are very close to the end. The tibialis anterior, and it does dorsiflexion. Remember, that's bringing the toes up towards the back. I don't like how the foot, any movement is flexion, but this one, you bring the toes up towards the back. That's the dorsal. Flexion is movement of the ankle. We've got that. So let's pull it up to look at it. Well, we can blow it up. We'll see how much it pixelates. Okay. So when you look at your tibialis anterior, obviously on the anterior side, in the front, it's going to be attached to the tibia a little bit to the lateral. At the insertion, it's crossed over, it's wrapped around to insert on the medial surface. Do we agree? Yeah? So what does that tell us? We might get a little bit of lateral rotation as it pulls. Because if it pulls, it's going to move that way. Let's see. The only thing they're talking about is the flexion, the dorsiflexion. Now the last two here, muscles of the lower leg, the gastrocnemius and the soleus, they're going to have a common tendon. This is a tendon you guys have all heard about before. We're talking about the tendon that commonly people call the Achilles tendon. I don't want you to call it that in this class. Tendon of the gastrocnemius is good. You could also call it the calcaneal tendon because it is attached to the calcaneus, the heel bone. Are we good? Does that make sense? Yes?
Yes.
All right. So we are talking about, and I'm sure you guys already figured that out, we are talking about this tendon right here. Good?
We have a question.
Yeah, sure.
So I don't know if this is like a legit question, but like you know when someone says they pull like a Charlie horse in their calf?
I've heard people say that, yeah.
Yeah. So like what pulls? Like these? Like
The pulling is iffy. I would say the accurate thing to say is they have a cramp.
okay.
And yeah, it's probably a cramp in the gastrocnemius.
Okay.
But what I was about to say, if you look, the last muscle on the list, the soleus, when we pull this gastrocnemius, the medial head, let's pull it off. Right here, this, we've got soleus underneath, okay? Soleus right here. That tendon, you can see a piece of it here. Look close. The tendon to the calcaneus, yes, it has the two heads of the gastrocnemius, but it also has the soleus underneath going down. You can see the body of the soleus right here. It goes down, and the muscle is further distal, but this end where you actually attach the calcaneus, that's still tendon. Got it? Tendon still ties muscle to bone. That, I think, is the end of our muscles. Not all the muscles in the world, but all the muscles used in this class. Are we good? Does that cover them all?
I think we're good.
All right? Everybody feel comfortable?
Yes.
All right.
For the most part.
Tendons
Louder.
and attach muscle to bone.
Oh, did I not do? Yeah,
No, I'm
tendons
just
tie.
trying to
Yeah,
remind myself.
tendons tie muscles to bone,
And ligaments link
bones together.
bones together.
Exactly. So when we talk about in the head rotation around the odontoid process that sticks up, or could call it the dens, right? Part of the axis, that part that sticks up here, we have rotating around it atop the atlas, yes? Well, it can't move like this because there is a ligament going from that side to that side, completing the circle. Does that make sense? Okay, we look at, we know that rotation of the radius in the radial notch is what allows us to move our wrists, rotate our wrists, yes? Well, it doesn't just sit there. We have a ligament going from here to there, which completes the circle. Does that make sense? Okay. When we look,
Organic Velcro.
what? Yeah, oh, that's fair. Organic Velcro, that works. When we
Slide it together.
hook together the right here, we're going to do the interosseous membrane. That's basically a wide, giant version of the ligament. Does that make sense? Okay. Are we good so far?
Yes.
You guys feel okay? How much time do we have?
Like
20 minutes.
20 minutes? Okay. Stop the recording and we can try to quiz.